About Tom's identity. He's identified with both, and he's really been one of our strategic leaders in the STI and HIV field. Wrote some of the seminal observations about HIV in Africa in the 1980s, and has been leading the charge both in the field and in the lab ever since. So Tom is going to moderate the first few minutes. First few speakers.
Thanks so much, Sten. It's a real pleasure to be here and to be involved with this particular session. So that you all know you're in the right room, this session is going to be addressing the Fogarty International Center and how it's responded to the Global Health Challenge. Now, we've had a bit of a preface on this by Roger Glass, who's also going to re-update us on his remarks that he made in the opening plenary this morning. And to chair each of the sessions, who really put this together, I'll introduce my co-chair, Sten Vermund. Most of you know Sten because he is the PI that oversees the International Clinical Scholars and Fellows Program for the Fogarty, funded by the Fogarty. But let me give you a little bit of background. Sten is a professor of pediatrics, and he is the chair in global health, director of the Vanderbilt Institute for Global Health. He serves as the PI and the leader of the HIV Prevention Trials Group, funded by NIH, which conducts HIV prevention clinical trials in Africa, Asia, and the Americas. Actually, Sten and I have worked together when he used to be at NIH, and then subsequently when he went to University of Alabama, and then subsequently to Vanderbilt. And right now in the HIV field, although treatment has been a major introduction to survival issues, we're still struggling in the prevention field, and there are many trials like the one we heard discussed, which is the tenofovir microbicide gel, which came out of Sten's HPTN trials network, and with USAID support as well. So it's a real pleasure that everyone is here, and the recipients of these scholar awards from Fogarty. We're going to get to hear individual life-changing events that have taken place as a result of the Fogarty funding for this. I have to say I've been with the NIH for over 30 years. And the first institute that I got brought when I finished my fellowship that I actually worked in for 2 years was the Fogarty. So I actually got to see the inner workings of the center. And I have to admit that with the little tiny amount of money, I heard Roger say $70 million a year, they accomplish 10 times more per dollar awarded than any other center. And I'm with NIAID. Tony might argue with me a tiny bit, but that's okay. I really, yeah, I know it. I really do feel quite strong that Fogarty has been a leading force at the NIH, and that the NIH is really quite gratified that we have the Fogarty Center doing what it's doing. So we're going to hear from the recipients of the Scholar Awards, but to start off and to expand on his earlier remarks, I'm going to invite Dr. Roger Glass, the director of the Fogarty International Center, to give us some opening remarks as a lead-in to the subsequent discussions. Roger's already been introduced.
Should I sit here or stand
up? That's your choice. It's definitely your choice.
Maybe I'll stand up.
Yeah. Now, while Roger's getting ready, let me tell you the format of this. So I think we'll have Roger talk and maybe take a couple questions after Roger, and then do individual introductions of each of the individual speakers right before they present, because it's going to be very pertinent to their background and their experiences. And then we can open up the discussion. And what you should all be thinking is, what should Fogarty be doing more of and better in the future years? This is your one chance to influence the director of both the center as well as the coordinators of these programs. Roger.
Thank you.